Hello, welcome to Global Business. I am Imewore Ohyamokai. Now, a lot of you have been sending in answers for our questions to be part of the skill empowerment scheme. Of course, not one person has gotten the answer. So we decided that since we'll still want you, because we have space for 20 people to get empowered by skills. And so what do we do? And so we said, okay, just tell us what you like about global business, since you didn't get the answers to the questions. But we will tell you the answers to the questions. So if you want to, of course, participate in this skill acquisition contest, just send us, what do you like about global business? Send it to 0701 612949. Those are the phone numbers. Just send it and you'll be part of the scheme. Now, the answers to the questions. What were the questions again? One, what is TAP? TAP is just the August project. The August project. Now, what are the three structures of TAP? The intellectual, the economic, and the leadership. Those are the three structures. Those are just the answers I needed from you. But if you were watching Global Business, you should have gotten that answer. So I expect you to send in your answers or send in your contributions now to be part of this. What do you like about global business? So let's empower our youth, those between 18 and 35. That's if you are not between 18 and 35, you are not entitled to answer these questions. So if you are between 18 and 35, then of course we'll be able to empower you. Next week, we will unravel our requirements to get our loans. Remember that Global Business and the TAP project, which is the August project, will be giving at least 100,000 naira to 15 to 20 people too. 100,000 naira to start your own business. It is a loan. Of course, Microfinance Bank is going to be assisting us to do all that. That's about TAP. But right here, we are at the Nigeria Health Watch, the Future of Health Conference. And we're looking at the business of health. So today, we're going to be talking to people who will be telling you about the business of health. I'm sure you didn't know that there was business in health. You didn't, isn't it? Anyway, now you know, and you will find out more about the business of health. It's Global Business. We've got a packed package for you. Stay tuned. Still at the Nigerian Health Watch, business of health. That's what we're talking about, disrupting the medical space. And of course, we're going to look at what's the origin of this talk shop, which we hope will go beyond the talk shop to become something very meaningful. And we're going to be talking with one of the directors of the Nigerian Health Watch. His name is Ifeanyi Usofor. Ifeanyi Usofor is the director of policy and advocacy. Okay, so Ifeanyi, tell us what inspired this talk shop.
Okay, so first of all, our Future of Health Conference is our premier annual conference every year. Started 3 years ago. Okay. Our first conference was on redefining the health sector of our dreams, 2015. 2016, it was on health meets tech, getting the two ecosystems to come together and begin to design solutions for the health sector. Then this year, we decided to focus on the business of health. And it's simply because when you look around the health ecosystem, you realize that a lot of people do not really think that they should apply sound business principles in running, healthcare delivery, especially within maybe the non-profit and not-for-profit and the government sectors. So that's why we were very careful in the kind of speakers we selected. One, to come and share their own experiences in the kind of work that they do, so that in doing that we can learn some of the ways, that business should be run. But for us, again, as Nigeria Health Watch, we think that one of the core things is for health workers to realize that part of running a business is understanding that the patient is king, because the patient is the customer, which is lacking in most healthcare facilities in Nigeria. And that's really why we decided on this theme for this year.
And what will go beyond the talk now?
Okay, so beyond,
because like somebody said,
Yeah.
he's tired of people becoming advocates. Now people should be activists for health.
Yes. So for us, again, in Nigeria Health Watch, what we try to do is for Nigerians to realize that there's so much that civil society organizations like us can do. We want to inform the Nigerian public about what a healthcare business should be like. So like I spoke about patient-centered care. When you go to health facility, you should know that as a patient, you're the person that should actually be running things. Your needs have to be taken into consideration. They have to be courteous to you. When government is budgeting for healthcare, you need to be aware of it, and you need to know what those funds will be used for. When people talk about politics in Nigeria, for example, very few people talk about healthcare, because somehow we're a bit, lackadaisical about health in Nigeria. But we want that to change, because business of health can also improve when the users of healthcare, the clients, know what quality care is all about and demand for that quality care. So one of the outcomes of this conference for us is to improve that, health literacy for people. And already, even just before today, some of our partners, so let's talking about, so how can we take this discussion further? So for example, one of our partners has even been asking, is it possible for us to even get microfinance banks and health to sit down and say, okay, how can you ensure that as you're giving small loans to small businesses, you tie in healthcare as part of that, so that most of them don't end up spending a lot of their profits on paying for healthcare and things. So already there are discussions coming up, and for us, our conferences usually there are outcomes that we follow up with every year. Like last year, Health Mistake, we did it, but ultimately we now partnered with Facebook to organize a hackathon to design solutions for the health sector. So we know that this year again will not be different. Already we're having discussions, in taking it forward.
Ifeanyi Osafor is the Director of Policy and Advocacy. I want to change his title today, because it now be Ifeanyi Osafor, Director of Policy and Activism for Nigeria Health Watch.
Absolutely.
Thank you very much
Thank you so
for
much.
coming on Global Business. We're still on the business of health after the break. Welcome back. It's still Global Business on your Africa Independent Television. And today, I told you we're at the Business of Health Conference holding in Abuja. And I've got two speakers that have spoken already in that conference. And in fact, they disrupted my mind. Of course, that's why we're talking about the business of health disrupting the medical space. We have, by my right, Peter Bankole, who is the director of the Enterprise Development Center of the Pan-African University. Peter, welcome. Pan-Atlantic University, I beg your pardon. Welcome. And of course, Ezine Anyang, who is the Chief Executive of Efferent Services Limited. Did I pronounce that?
Yes, Efferent, yes.
Efferent.
Thank
Okay.
you.
Now, let's start with Peter. I heard you speak, and you see, I was thinking, because not too long ago, I put on social media where a story where someone who had a bullet wound was left to die in Port Harcourt 11 hours after he was shot, and he went to 3 hospitals because they couldn't give him Medicare because of some sort of reasons, which include the police report. But it comes to mind that medically, Medicare is not profitable, and yet we have the irony of someone who wants to make profit from opening a pharmacy, from opening an HMO, or from even having a hospital or a clinic, because that's why they do that these days. None of them is an NGO.
First of all, it is not true that it's not profitable, but it oscillates between being profitable and being sustainable. I think that's the operating word. If you think if I use the example that you gave, it's also very inefficient in reporting and in tracking where service can be rendered. So when this guy was shot, he could press a number and they can say this facility can take you in. Now, if they're worried about police report and all of that, you can immediately treat a patient with a gunshot and send an SMS to the police station.
Alerting the police.
Alerting that we have just done this or we are doing this. Before the person recovers and you get discharged, the police will be there to take whatever records they need to take. So we are not going to circumvent the law, because yes, if you are shot, something is wrong. It could be that it was in some kind of gun duet. We want to know what happened. So that we can still do, but we don't have to lose a life to do that. So this is one. The second thing is beyond. So I talked about efficiency, but transparency is also very important. So long as people, if I need to access the medical care, I can just quickly say, this is what I want to do. Where can I find a provider? And with the kind of thing that Ezinne is doing, I don't know whether she's doing that right now, but you can use technology to quickly find, in the same way that we request for Uber. And so I can just go, I need this service, where can I get it? This is where I'm standing. And very quickly, they can tell me where I can go, and I can request for a cab to drop me there, and boom, I have service. I don't have to wait for 11 hours.
Now, isn't it efferent first? Is it another word for different?
No. Efferent is actually an anatomical word. It's the nerve that moves our muscles to action.
Okay.
So for us, we're here to drive healthcare to action.
Well, I must tell you that Ezinne is a trained nurse and a trained business lady. She went to school for both of them. Now, I'm going to take something I took from that conference, which was somebody talked about the fact that we had fantastic medical practitioners in this country, but they have no business management. You came into this country, opened a business in time of recession. You opened your business 2 years ago, and that was when Nigeria slipped into recession. Now, how have you, and it's medical business, how have you fared doing medical business within a country that has a tough economic situation?
Thank you very much for that. I would say it definitely was very important to us to first understand what our potential clients were asking for. Because at that time, many of our potential clients were just looking to maintain what they had. Because one, they were losing the patient volumes, because now people are having to choose from eating, feeding their kids, or going to get healthcare. So the volumes that they were seeing weren't quite as much. And then secondly, we always knew that technology and healthcare is the last sector to really evolve. Agriculture have actually surpassed healthcare in terms of innovation and mechanical agri. And so knowing that, we also knew in order for us to be successful, we had to first understand what does our clients want technology to do for them? And that was really what helped us finally focus where we are now. And in doing that, I would actually say it was the best time for us to start a business, because it forced us to let go of all the Western innovative thinking that we brought in and truly develop products and services that was custom fit to the constraints that Nigeria was facing at the time. And we're glad that we have great advisors and great partnerships. I spoke a lot about partnerships. Without our partners and advisors, I think that they're really the pivot, the foundation for our success.
Now, you talk of partnerships, and people want to ask, how do you create partnerships?
You create partnerships by creating value, by having a strong value proposition. Because we've done a lot of our homework from our potential customers, these are the people that we're expecting to pay us for services, and identifying that. And then also looking at what are those processes we need to have in place. We can't develop every single technology that our clients are asking for, but there are organizations that are doing this and doing it very well. And so coming together and really helping them understand that there is a real need here, and this is how they play. And of course, this is what the revenue model will be, because we were faced with high quality, cost effective, and user friendly. That was what everyone was asking for. And so in doing this, that really helped us really advance. So it's more about value. We had a very strong value proposition.
Now, Peter, I've tried as much as possible to avoid what everyone will paint the pessimistic nature of the Medicare in Nigeria, or the health system in Nigeria. People say it's on a downward trend, but I'm looking at the positive sides. Looking at the positive sides, in what way, beyond what you have said, I noticed you talked a lot about using technology to improve our Medicare and making the process easier. How does technology fit in Nigeria that has a growing mobile phone technology, in Nigeria that also has a deepening internet penetration? How does technology come into place for Medicare? You just mentioned one initially, but I want you to talk more about it.
Very interestingly, I like the way you have couched it. Deepening internet penetration, and then secondly, we have the infrastructure, which is the mobile phones in our hands. Think of the banking industry in the last 5 years. Things have changed. One day I was speaking with my daughter. I said I wanted to go and collect a checkbook. And she looked at me as if, from which world are you from?
I mean, who uses checkbook these days?
I didn't want to put it like that.
Who uses checkbook these days?
That's one. And I made a lot of effort to convince her that I will use that checkbook. 1 year later, after collecting that checkbook, my transaction with my bank has more than doubled, and I have not even written one check up till now. So, what am I saying? In the same way, 70% of the people that will transact with health facilities may not necessarily have to go to the hospitals. That is going to happen. Why? Because we have the gadgets to be able to make it happen. Just in the exhibition here, there's somebody that handed over to me a pamphlet around using ATM to do diagnosis. ATM. And so it means anybody in any village, in any rural community can have access to the basic diagnosis that should and could be done. Once you can do that, the next stage is, okay, somebody needs to interpret whatever it is to you. That is simple. Because it's internet-based, they can send your results to some kind of database in the cloud, and then somebody interprets it and send it back to you, because we have your phone number. And if it's a smartphone, I can share it. If it's even a feature phone, you can download on a voice note. So I just speak to you. Not just speak to you, I can speak to you in any of the major languages that you want to hear. So at the end of the day, 70% of the people will have access, but we don't even need to go to the medical facility.
Isn't it? Do you think healthcare providers in Nigeria are thinking out of the box enough to service the populace, especially using technology?
Absolutely, absolutely. I think that there's a great awareness that technology has to play a pivotal role, and that patients are coming now with more. Before patients even see their doctors, they've already diagnosed themselves, and they do it all on their mobile phones. And so there's sort of like that push now for doctors to better integrate those services, because patients are demanding better quality of care because they can get it from their mobile phones online. And so if a patient walks in, haven't done what they need to do to have a lot of information, and then going to a provider who doesn't even regard that, the chances that the patient will go back to that provider is a lot slimmer. And so in all of our discussions with various providers, the good thing is that there is that awareness that technology is needed, and is going to play an important role. But now some of the constraints that we're finding is around infrastructure, power. Some of these facilities don't have power to run certain types of technology. Connectivity, believe it or not, most of them do operate in their mobile phones. And some innovative technologies go beyond mobile phones. And then of course usability and then cost. And so for us, just giving an actual example of what we're doing now in the radiology space, what we were finding was a huge gap from the time a patient is seen to the time the radiologist reports can take up to 2 weeks. We've heard 2 weeks. If it was an emergency case, days. But how do we then bring the patient closer to the radiologist when this radiologist might be in that facility only once a week? And so for us, we're able to transmit those images and the radiologist can access it from anywhere. So patients don't actually need to see their radiologist. They'll just know that their reports are going to be ready and their doctors are going to get the reports within minutes, not days, not weeks. And so these are some of the simple ways that technology is really bridging a gap, and providers are adopting, but we still have a lot to do in terms of finding technologies that really embed in their workflow so it doesn't seem like an additional task, because that's the big thing, is as long as it seamlessly embeds within your workflow so that they can still focus on patient care. I think that's where providers like, but now there's still some work to be done there, but the key is that the awareness is there and they recognize it, and so we're working with them to get them to innovate.
Now, Peter, does proliferation of, or does technology encourage proliferation of clinics all across, or does it actually discourage it?
You know, there are always going to be different business models. One is not going to drive the other away. They are going to be complementary. In situations where you will have emergencies and people need to physically be, they will go. Remember I said 70%, so the 30% must go somewhere. But it just means that we will then have better care for the 30% that must then walk in. So my attitude is not that one will drive the other away, but they will be complementary in the way it happens.
Okay, finally, let's look at the general Nigerian situation. Let's come back home now and look at the situation. Doctors on strike most parts of the year. Even, let me not call it doctors, let me say health workers, but doctors, nurses, and all that. How can the consumer himself benefit from a healthcare that is not thoroughly grounded, not thoroughly satisfying, even for those who work there? How can they benefit?
And so as I mentioned earlier, technology really can bring the patients closer to a provider without without being there physically. So I think the striking is something that...
I'm sorry to cut you. I didn't mention that we have a population that has weak economic base, has a weak economic base. So even in talking about technology, let's also consider the purse of the common man.
Absolutely, and that's why for our business, what we found that has worked very well for us is volume-based subscription business. Because when you have volume-based subscription business, that means the out-of-pocket expense or the capital that you need to invest in an IT infrastructure is going to be a lot less. Many providers, if we were to give them some of the technology we're giving them, they wouldn't be able to afford it, and we understand this. And so we had to work very closely with our partners to understand that what we're trying to do is more on a long-term sustainable model, and in order to do that, we had to focus on volume-based. So creating a technology that's affordable. Affordability is key for us to be able to get accessibility. And so for us, that's the model that would address that, whereas some of the out-of-pocket expenses that we're expecting these providers to make when their patient volumes are still going down significantly because people are now diagnosing themselves on their phone. We found that the business model that's worked for us to address those economic constraints are volume-based, subscription-based type of business.
You know, people will always make use of the medical services, and people can pay for it. It's just the way in which you structure it.
Absolutely.
If you ask me to bring 50,000 out today, it may be difficult. But if you take that 50,000 over a period of 6 months, it may be easier. In the same way, and I like your subscription model for the providers, because that's what we call fee for service or a pay-as-you-go type thing, and that's a lot easier. For the patient, it has to be exactly the same. And I use this example, 50 naira. Can you afford 50 naira a day? If you can, that is already a subscription of 18,000 in a year. And that will get you something really decent, all right? Beyond even the very basic access. Imagine if you then have it over a wider range of people. So rather than giving me discount on products, I can link discount and say, instead of giving this guy, I will give you medical insurance for 1 year.
So basically, it's health insurance we're talking about.
To some extent, but you have to have what I call the ecosystem thinking. It cannot just be me and me alone in my sector. How do I leverage on other sectors to be able to make my sector work? That is going to be the key. So people in the medical field will collaborate with those in the banking industry, will collaborate with the people in the pharmacy, and
even in the communication industry.
And in the communication industry, like we saw with Bond. And at the end of the day, one person will be the one that benefits most, the patient. Because the patient will have access to quality service, but for a fraction of what they will have paid for if they are doing it, out of pocket.
Thank you very much, Peter Bankole. Peter Bankole is the Director of Enterprise of the Pan-Atlantic University. I got it right this time. And of course, Ezinne Anyao. She's the CEO of Efferent. Efferent is oncology,
Human-based technology.
Human-based technology company. Thank you very much for coming on Global Business. So Global Business continues, and we're still at the Business Health Conference of Nigerian Health Watch. Well, as you can see, the Business of Health Conference is still on, but we'll have to wrap it up on Global Business for today. I want to say congratulations to Nigeria, who moved 24 places up in the ease of doing business. It's been wonderful doing business with you this Monday, and we've come to you from Sheraton Hotels in Abuja, where the Business of Health Conference, it's actually the future of health, looking at the business of health, and we've looked at how to disrupt the medical space. So if you are in the health business, please go and disrupt your medical space. I am Imewori Yomokai. Let's do business again next week.